My name is Sal Rosselli. I'm privileged to be our union's president. You know, you guys look beautiful. The energy that you've seen here this week, right, is duplicated everywhere, all right? Wednesday, I was in Los Angeles County, and just extraordinary. Again, you know, the energy that you see here, the unity, the excitement, the press, everything is going on in 18 cities, I think, yesterday across California. Yesterday I was in Orange County and San Diego, your colleagues in San Diego, the same, just most extraordinary. You know, I've been doing this for 38 years now, right? Lots of strikes. And this one is extraordinary in a number of ways, you know, relative to all of my experience. And the first one is the unity of you and your colleagues. It really is tremendous numbers. Very, very few folks, you know, have gone into work. I mean, it's way past 90%, which is an extraordinary number, folks. Extraordinary number. And the activity on the picket line, same kind of thing in terms of the percentage of folks that are doing it. Same record-breaking numbers, right, relative to what's normal. You know, I'll tell you, I'm always prepared. You know, you guys are risking a lot. Strikers risk a lot. Losing pay. This is hard. It's cold, right? I'm always prepared for criticism and complaints. It's not happening this time. It's just not happening. That means a lot. I mean, the biggest complaint I got yesterday, or the day before in Los Angeles, was these three workers come up to me from the Pasadena clinic and said, you know, we have something to discuss with you. We have a problem with the line of the union that people aren't getting appointments 4, 6, or 8 weeks. In our clinic, that would be a luxury. People have to wait 12 weeks in Pasadena for an appointment. You know? The press that we're getting, right, is just extraordinary. You know, well, the first day there were 26 cameras in 8 different cities broadcasting live from picket lines. 350-something TV hits the first day. The second day was like 280. It continued. No union can buy that kind of publicity. This strike should not be happening. You know, we all know that. It really is shameful that it's happening. You know, 3 years ago when we finally settled the contract after a 5-year battle, who was involved in that? It's 3 years. Okay, the strike, you know, in 2015. When we settled that contract, Kaiser made a commitment to hire 500 more clinicians, right? And a year after that, your president, a woman named Janet Liang, right, stood in a huge meeting. Some of you were there, right? A forum that we did. 100 of our leaders, 100 managers, and Janet Liang stood there next to us and said, we are committed to work together to make Kaiser Permanente the mental health care provider of choice and the best place to give mental health care and receive it. Well, they're not walking that talk. You know, we've been bargaining and meetings about this since last spring, formal bargaining since June. They're just not walking that talk. Nothing's happened at that bargaining table of any significance around the care issues. Well, they have a great line in the press, right? They've hired hundreds of clinicians. We've put another $175 million into new mental health clinics. Well, they did hire hundreds of clinicians, but also hundreds left. And not just retired. People left because they can't retain them because the work is so hard, right? Burned out, right? And the ratio of clinicians to Kaiser patients is the same today as it was 3 years ago. No different. Partly because of that turnover and partly because of Kaiser's growth. Just tens and hundreds of thousands of more Kaiser patients to take care of. So that's one issue. In Southern California, by the way, here's a slightly positive thing, although they're not walking their talk yet. In Northern California, they've now agreed that they have to phase out subcontracting. Right? Because they can't count on these subcontractors delivering good care. The only way they can guarantee it is to bring it in-house. It's going to take time, but they've agreed to the concept. Southern California, same Kaiser Permanente, just the opposite. They say it is part of our business plan to subcontract. They're contracting out 40,000 patients in Southern California, almost a third of all their service, and they're saying that's the way it is. So that's a huge hurdle that we have to get past in Southern California. So that's one of the two issues that we're fighting over. Care. Complicated stuff, right, to resolve it, but your clinicians can figure it out, right? You guys know how to do it. The second is economics. And then, they're lying to the press, it's all about money. Well, I'll tell you, it is all about money. Kaiser's got the money. You got $48 billion in reserves and investments, right? They need to spend it. But it is an economic issue with us, but not the way they're presenting it, right? We can settle this contract tomorrow from our point of view with the same exact benefit package and COLAs, cost of living percentage increases, that Kaiser has given to 100,000 of their workers that are on the medical side. The same thing, nothing more. The same exact thing, right? And the press are getting that. When I talk to the press, they get it. It's not only parity for patients, it's parity for the people taking care of the patients. Tired of being second class, right? Yeah. So that's what we're fighting over. Fundamentally important that we have political support, right? Elected leaders regulate healthcare. Large part of funding comes from government. We're winning big time. And this strike, helped a great deal with that. Lots of electeds have been on our picket line, but others behind the scenes are really working this. This week, Tony Atkins, the president of the California Senate, this great leader from San Diego, right, longtime friend of ours, she called Greg Adams. She knows the issues, and she talked to them about that in detail and said, be clear, I'm standing with NUHW. Eric Garcetti, met with him last Sunday. He's going to be making a call next week, and I'll tell you about next week in a couple of minutes. Speaker Rendon, the same, very important. He's with us. Patrick Kennedy, I hope you've seen the video. If you haven't seen that 3-minute Channel 2 piece from Tuesday night, take a look at it. It's just like a 3-minute summary of the press we're getting, right? The press really gets it, right? They're really presenting our point of view. This new relationship with Patrick Kennedy is just the beginning. I mean, he's telling the world that we're the only union in the country, and he travels the country constantly that is standing up for mental health care. And he's telling the world that this action in California is going to affect achieving parity in the rest of the country. We are making, our union together are making mental health care the civil rights issue of our time, right? Gavin Newsom, different governor than our Jerry Brown. Mental health care, very personal to him. He's got a very comprehensive program. You can see it on his website in terms of achieving parity. And so, the fight we had several years ago, we learned that Kaiser has such inappropriate influence in state government, especially with DMHC, Department of Managed Health Care. Such inappropriate influence. It took us that $4 million fine, drop in the bucket. It took us 3 years to get that. So next steps, folks. There's bargaining scheduled next week, both north and south, but it's meaningless. Nothing's happened since June in terms of at the local table, right? But here's the positive front. A few days ago, a guy named Dennis Dabney, who's the National VP for Labor Relations, contacted us and said, requesting a meeting with Janet Liang, the president of Northern California, and her counterpart in Southern California. That meeting is scheduled for a week from today. Okay, so we're hopeful that means that they really want to get down to it and figure it out. Clem Papazian's going to come to this meeting with us, and one of your colleagues, a psychologist from San Diego, and one of the leaders from the professional unit in Southern California. We'll have that meeting, and we'll then arrange calls and discussions about what happens there and what to do next. So that's my quick update, and I just want to I'm proud of you. You're the heroes. Any particular questions for a few minutes?
So I have a question. You said a couple of days ago that one of the representatives called you and wanted to set up a meeting for Monday. Can you speak?
No, it's just what I referred to.